You're thinking about filing for Social Security disability benefits. What is the difference between SSDI and SSI? Can you get disability and retirement benefits at the same time? Do you know anybody that's thinking about, are you appealing? Are you allowed to work when you're receiving disability benefits? Well, if you have any of these questions, you or your family have any of these questions, this is the time for you. I'm going to go over that. I'm going to go over some of the top questions that people ask about disability. This is a third in a series of the top 20 questions people ask about Social Security. So today we're kind of focusing in on the disability part of that. What qualifies, what's the difference between the SSDI, what's going on with the wait times and all the rest of it. And because there's exceptions, the exceptions, when we're talking about all things Social Security, also going to be a live Q&A. So I already got a bunch of questions. So if you got any questions, make sure you type it in the live Q&A. If you're watching this on a recording, make sure you subscribe and like and share and all that kind of good stuff. And that way you can find us in the future when you or someone you know needs help. So, all right, let's get into all of this right now. So the number one question is, what qualifies someone for SSDI? And what is... I'll kind of break this into, I'll answer question number 11 and 12 kind of together there because they kind of fit in together. All right, so what qualifies for someone from SSDI, SSI? Let's start off with the difference. Both of these, SSI and SSDI, are based on disability. SSI, supplemental security income, people often think that means Social Security income, and it doesn't. SSI is a needs-based, a welfare-based program. So you have to have low income, low resources in order to receive SSI based on your disability. So SSI is based on disability, supplemental security income, low resources. It's the welfare program that Social Security administers. You can also get SSI what's called aged. So if you're 65 and older and you're low income, low resources, you're also eligible to get SSI from Social Security because you're 65 and older. There's a limit to how much it pays. This year, 2025, it's $967. So if you make over that, then you wouldn't qualify for SSI. There's a $20 exclusion there, but what I say about exceptions, the exceptions. Okay, so that's the SSI part. So in order to get SSI, if you're under 65 years old, then you will need to be determined disabled. And for SSDI, so Social Security Disability Insurance, that's the insurance part of it. That's what you actually paid into when you paid your FICA taxes on Social Security all those decades. That goes into retirement, and it pays for, your retirement when you get older. It pays for spouse benefits, surviving spouse benefits. Part of the FICA also pays for your Medicare, but this also pays for SSDI, Social Security Disability Insurance. So same type of situation, you have to be determined to be disabled, but SSDI they don't care about your income or resources necessarily, except for income in terms of working, because Social Security determines your disability based on work, your inability to work. So if you're unable to work because of your disability or disabilities, and your disability is going to last 12 months or longer, then you could very well be eligible for SSDI or disability, SSI or SSDI. So inability to work, you can still work. It's called substantial gainful activity. So if you are disabled and you're just barely getting by working, you can make up to, this year, 2025, it's $1,620. If you make over that, then Social Security considered you're able to work substantially. Substantial gainful activity is the term they use. So if you're unable to work because of your disability, or you've had to reduce your work because of your disability, and that's under $1,620 for 2025, then if you're disabled and that disability is going to last 12 months or longer, or end in death, that's the policy, then I would definitely apply for disability benefits. What qualifies in terms of disabilities? You hear a lot of people saying, well, this qualifies, that qualify. My philosophy on it, if you're unable to work because of a disability or disabilities, apply. You never know, because people say, well, they focus on this disability and that might not be in the manual of that particular disability, but because you have this other, other condition, you've got this other condition, and you take this medication and it, prevents you from working, and you have to go to, the bathroom 30 times a day. And I don't know how many employers are going to allow you to work and you're being in the bathroom all day because of some medication. So there's so many different variables. And so don't let anybody tell you, well, that's the Social Security never approves people for that disability and Social Security denies everybody the first time. We've got a lot of people here in our community that have had their applications approved the first time. Just had someone yesterday, I think he said he was approved in 26 days. I've taken cases that they were approved the same day, the next day. So people out there, they try to be negative and they say, well, everybody's denied the first time. That's all BS. Please stop saying it. Those people that say it just to be negative, please stop saying it, because you're really depressing those people that, or have a disability or unable to work. They're dealing with their disability and their medications and financial situations. And, they just can't take another negative person in their life. So just tell them, if you don't have anything positive to say, as our parents used to say, then, anyway. So just apply for disability benefits. The process is, yes, it is a nightmare. To file, it takes about an hour or so. You can do it online, or you can call and schedule an appointment. You don't need your medical records or anything like that. What happens is when you apply, Social Security asks you all your doctors and your prescriptions and what you went and saw those doctors for and all the rest of it. And they will get the medical evidence directly from those doctors, clinics, and hospitals and stuff. On my website, mygovexpert.com, you can go to SSA.gov or go to my website, mygovexpert.com. And then I've got a bunch of information there on retirement, disability survivors, overpayments, Medicare, appeals, myths. And it gives you all the eligibility, as I mentioned. SSDI is different than SSI. And then it also has about things about ALS and ESRD. And as Bella has pointed out in the comments, there's what's called compassionate allowances. There's a set of disabilities that Social Security has. I've got it on the website as well. Some of them that are kind of like super expedited. So if you have one of those, they will expedite it, and Social Security has this kind of algorithm that they use, and that's how people get approved the same day. I've had many cases that someone comes in at 9 o'clock, I take their application, it takes about an hour or so. I send it up to what's called DDS. Those are the people, the state agency that actually make the medical determination. And end of the day, or first walk in the office the next day, and they're approved. So they have a good system for those people that really need it. And unfortunately, with the low staffing nowadays, if it's not a critical type of a Terry case, for instance, a Terry case are the worst cases. Those are the terminal illness cases. If you're a wounded warrior, then those are expedited. But if you just have a regular disability, then unfortunately we're talking 6 to 9 months to get the initial decision. Unfortunately, it's been, when I used to take claims when I was working actively at Social Security, everybody at that time, we used to tell people you'd get your answer about 3 to 6 months, the first decision. Now it's 6 to 9 months if you're lucky. Social Security and all those agencies have a very low staffing right now. Elon Musk and Doge came in there and got rid of a bunch of people, so it takes quite a while. So again, SSDI, you can get that up until your full retirement age, and we'll talk about the fact that your Social Security disability benefits, yes, will 100% stop eventually, but that's a good thing. We'll talk about here in a little bit. So the wait, as I said, the first stage, the initial claim stage, 6 to 9 months to get a decision, sometimes a little bit longer than that. The ones that come, I talked about this yesterday, it's kind of a bittersweet that This gentleman yesterday, he said he was approved in 26 days, and I'm like, that's great. The Social Security take care of you like that. Everything went well, but that means that person has a really bad disability. If it was approved that quickly, so it's kind of a bittersweet. Yes, glad they took care of you. Sad that you've got such a terrible disability that that they were able to expedite it. So in the second stage, if you're denied, you have appeal rights, and always, 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 always fight. If you disagree with the decision, fight it. And so on my website, let me pop it up here, mygovexpert.com again. On the website, you've got the appeals process, and it tells you the different types of appeals. So the first one is the initial claim you file, the brand new claim you file. If you're denied within 60 days or so, you can do a reconsideration. And then you can also look at my website, and I probably a better one here. You click on the appeals, and it gives you the level 1, level 2, level 3, level 4. So the appeals reconsideration, super easy to do. You fill out this little form right here, the 561, takes about 10 minutes to fill it out. And then you send it in. Unfortunately, it takes another 6 to 9 months to get a decision there. If you're denied there, then you have another appeal, the administrative law judge. Again, another super easy form to fill out, SSA or the 501, you fill that out, and that one takes a good year or so to get a decision. And people always ask me, what about lawyers? Should I hire a lawyer? If you want a lawyer, go for it. Lawyers charge, they don't charge unless you win. And that's why lawyers, they're kind of selective in the cases they take, and therefore, they get a higher approval rate because they're selective in the cases they take. But they get 25% of back pay, and I think it just changed this year to $9,200, up to $9,200. There's some exceptions that the judge can determine. So that's only if you win. So I personally, the initial stage of the reconsideration, you can do that yourself. If you want to hire a lawyer, more power to you, but you can do that yourself. It's pretty easy. Social Security asks you the same questions a lawyer would ask you in those first two stages. If you go to the administrative law judge stage, then I would probably get a lawyer. And in terms of what kind of lawyer, I'm sure you've got billboards all over your town that, someone that does, accidents, they also do disability, Social Security disability. So just look for, I always recommend kind of someone in your local area, because they know the local judges and the local doctors and stuff like that. So they, a little bit inside scoop there. So it doesn't hurt to get somebody local. And then if you're denied at the administrative law judge stage, then you can go to what's called the appeals council. It's another form you send out, and they just basically review what the administrative law judge said. And then if you're denied there, you can go all the way to federal court. And then I guess there's a level 5, you can go all the way to the Supreme Court if the Supreme Court takes your particular case on your disability. So with everything Social Security, Medicare, Medicare Advantage, Medicaid, food stamps, Section 8 housing, everything, if you disagree with the decision the government or a company makes, always, always, always appeal it. There's usually better chances of getting approved on things once you appeal it. Okay, so wait time. So that's kind of an overview of the wait time. Unfortunately, it's way, way, way too long. If you don't want your case to wait, then perhaps you need to contact your politicians and tell them to fix the system. It was estimated a couple of years ago that about 30,000 people a year pass away while they're waiting for their disability claims to be adjudicated. And that's, part of, just people's disability that, they file and they have a terminal illness, and that's unfortunate. But they all take way, way too long. They shouldn't take this long. You paid for that money when you paid your FICA taxes. If we're talking SSDI here, you paid into that in order to get help if you ever become disabled, or you get lucky and you retire, or surviving spouse benefits and all the rest of it. So, okay, so the next question here, 14. So if you have any questions within theirs, because question 11, 12, 13, they all have about 4,000 different variables in there, and I'm sure there's a bunch of people with some variables out there that want to discuss, so make sure you type it in the chat. or join us again if you're watching this in a recording. When do people on disability get Medicare? So normally you get Medicare at 65 years old, but if you're on disability, SSDI, not SSI, because SSI is, again, it's a welfare-based program. You don't have to pay into Social Security, FICA taxes in order to get SSI. But if you are getting SSDI, some people do get SSI and SSDI. So if you're SSDI, your Social Security Disability Insurance is, let's say it's only $500, and you have low income, low resources, they can also approve you for SSI. So you can receive SSI and SSDI. So in this case, let's say you're receiving $500 from SSDI, and you'll get another $467 from SSI for a total of the $967. So I think I did my math right there. So anyway, so for Medicare, if you're on SSDI, even receiving $1 from SSDI, you get your Medicare after being on SSDI for 24 months. Okay, 24 months, your Medicare starts automatically. Medicare will send you your package in the mail with your Part A, Part B card. And so there's a lot of people don't realize that they get Medicare and they go out there and they get their private insurance and they're spending all this money, and then it's like, wait a second, you've got Medicare. So that's one thing. Another reason, if you're receiving disability benefits, you really need to update your address with Social Security. Once you update it with Social Security, then they contact Medicare and they interface. And so Medicare also knows your address, and that way they send you your Medicare card to the right place. If you have health insurance from work, current work, or your spouse's work, usually when you're on disability, you don't have it from your work because you're not working for the most part. But if your spouse is receiving health insurance from current work, so that person is currently working and receiving health insurance from current work, you are receiving health insurance from current work, that employer plan has 20 or more employees, then you actually don't need to sign up for Part B. The Part B costs you $185 this year, so you can actually refuse that. You'll still get the Part A, that's zero premium, but Part B, you can refuse that because you have creditable coverage. Okay. All right. So Medicare. And another thing people on disability miss is that, let's say they file for benefits and they're refused, denied, and they do the right thing and they file an appeal and they finally get approved after a year and a half or 2 years. So they just get the letter last year or last month, and it says, you have been approved for disability, and yeah, we should have approved you 2 years ago when you first filed. So here's all your back pay. That also counts as your 24 months. So there are people that get approved for disability benefits and yesterday, and they get that check, and then next week they get their Medicare card and they say, wait a second, I just got my disability approved yesterday. Yeah, but they went back 2 years, and that served as your 24-month waiting period. So be very, very careful in that, because people go out there and spend money on health insurance when they don't need to. Okay. In terms of Medicare, one of the problems of having Medicare from a disability is that in most states, you're probably only going to be able to get a Medicare Advantage plan. In a lot of states, you can't get a Medicare supplement plan if you're receiving Medicare based on a disability. You're under 65 years old. Health insurance companies have determined, hey, these people that are receiving Medicare under 65 are disabled. They're going to cost us a lot of money. So they go to your state lawmakers, politicians, and they do what they do. So a lot of states, you can't get a Medicare supplement plan, but you can get a Medicare Advantage plan. They can't deny you for any pre-existing conditions on a Medicare Advantage plan. So what people do is, if they want a Medicare supplement plan, they can't get it, they go ahead and get a Medicare Advantage plan. And then once you turn 65, then you're in your golden opportunity window, and you don't have to go through any health underwriting or anything like that. They're not able to charge you extra or deny you because you're 65 now, and so you have that golden opportunity to switch from a Medicare Advantage to a Medicare supplement plan. And I'll throw up a phone number here pretty soon of a an organization we recommend that can help you with that. So, can disability benefits be stopped? Absolutely. So if your disability ends every now and then, depending on the nature of your disability, you will get what's called a CDR, a continuing disability review. And there's two types. There's a medical CDR and a work CDR. A medical CDR is check to see if you're still disabled. A work CDR is to check to see if you're working. Because people can work when they're disabled. There was this guy named Franklin Delano Roosevelt, right? Had polio, was in a wheelchair, but he was a president for a few years. So Social Security would not consider him to be disabled because he was working. So you can be disabled and work. And if you're able to work, then making over the substantial gainful activity, the $1,620, then you just might eventually be cut off. And why do I say might eventually? I've done a few videos on this. It's very complicated. A lot of people make mistakes on working and receiving disability benefits. So I came up with a couple of ways. Again, you go to mygovexpert.com, click on the little disability tab there, and then click on working and benefits. And it tells you that, in fact, you can work. Trial work period, the extended period of eligibility. You've got EXR. It's complicated, and so I've got a couple of PDF guides there. It tells you work incentives and some of the acronyms there, and it tells you the different steps and how much you can make and all the rest of it. So you can refer to this and also to refer to the SSA.gov website, and you can, in fact, work. But you just have to make sure you stay under all the limitations. Okay. That's why a lot of people make mistakes is they misinterpret the trigger month for the trial work period versus the substantial gainful activity, and then they get in trouble there. And so, yeah, so make sure you do everything right there. All right. So, and there's another time everybody, if you're on disability, your disability is going to end 100%. Obviously, when you shuffle off your mortal coil, all our disabilities end, right? But also, Social Security, when you hit your full retirement age, your disability benefits will end. So everybody's Social Security disability will end once they hit their full retirement age, whether it's 66 and 8 months or 10 months or 67 years old. If you're born 1960 and after, then your full retirement age is 67 years old. If you're on disability benefits, they will end when you're 67 years old. And there's nobody in the country receiving disability benefits after their full retirement age. And there are going to be a lot of people typing in the comments, no, I've been receiving benefits for 30 years and I'm 75 years old. I'm still receiving disability benefits. No, you're not. No. Your disability benefits, if you're 75 years old, your disability benefits probably stopped when you were 65, 66 or whatever, at your full retirement age. And most people don't even know it. Because the check stays the same, direct deposit timing stays the same. They don't even notice they're switched. They're basically, it's more of a bureaucratic thing that they stop taking the money out of the Social Security Disability Trust Fund and they start taking it out of the Social Security Retirement Trust Fund. So it's just a bureaucratic thing, but it's good for you. There's so many people out there that are struggling that can make their life better, but they don't know that they've been switched from disability to retirement. Because if you're, 68, 70, 75 years old, you're no longer on disability benefits. You're on regular retirement, and you're on regular retirement after your full retirement age. So there is no more work limitations. We see people all the time coming in here. I'm 75 years old and I got offered a job, sitting around at my friend's store. It's super, super easy. I can do it, but I don't want to lose my disability. We're like, no, you're not on disability. You're on regular retirement. You're after your full retirement age. You can make $1 billion a month and it doesn't affect your Social Security negatively at all. So go for it. And stop stressing about those CDRs, the continuing disability reviews. Because you're not on disability. You're on regular retirement benefits. So you're free. You can do whatever you want. So I actually did a kind of a clickbaitish type of you have to play with the algorithm sometime and to get the information out there. So was it several weeks ago, 3 months ago, I did a video that I forget the numbers, 500,000 people are going to have their disability claims canceled this year, denied, terminated this year. And that is 100% accurate. A lot of people clicked it. So, oh my gosh, the new administration is going to cancel my disability benefits. No, that happens every year when people turn their full retirement age. So I was 100% correct. A little clickbaity there, but when I do kind of clickbaity stuff like that, I do it for a reason, because a lot of those people that see that, oh my gosh, my disability claim is going to be denied, the canceled, I'm going to lose my disability. It's good that they're losing their disability because they're past their full retirement age. And we want them to know that you're not receiving disability benefits anymore. You're receiving retirement. So stop stressing about CDRs and stop stressing about, can I work? Is this going to stop my disability benefits? So when we do kind of clickbaity stuff out there, we're doing it for a good reason, I would argue. So there's that. All right. And on my website, again, on disability, you can go in there. It's 100% free. You can see about eligibility, how they calculate your benefits, the application process, the appeals process, continuing disability reviews, working in benefits, Medicare, Medicaid, frequently asked questions, and all the rest of it. So go in there and definitely check it out. And got a bunch of questions in there. And again, there's exceptions. So let's get into some of those exceptions right now. And as usual, our live Q&A is sponsored by Chapter there. So if you need help with Medicare, Medicare Advantage, Medicare Supplements, Medicare Part D, make sure you call them up. Got the annual enrollment period here coming up October 15th. So please, please, please check your plans. Jackie, I am 64 and just received an overpayment letter. I had been told that my bonus would not be included, but they said it was when I called yesterday. Are they right? Yeah, if it's a bonus type from work, then yeah, that's considered your income from work. So it's earned income. So remember, there is if you just started your benefits, and so the first year you start your benefits, they can switch from an annual earnings limit, the $23,400, to a monthly. So sometimes it's like, okay, I just started my benefits this month because I stopped working last month. And then I had some extra leave that I sold and I got a bonus and stuff like that. So I got that this month. I didn't work this month. It was just money from before I started my benefits. In that case, it doesn't count. But probably you've been working and been receiving benefits, and yeah, the bonus does count. If it's again, work-related type thing, unfortunately. So for the overpayment, then you've got some ways to get rid of that or address it. Go onto my website, the overpayments tab there. Let's see here. So it goes, see, Bella, yes. Compassionate allowance listing, fast-tracked, yes. As I mentioned, there's a listing of compassionate allowances, particular disabilities that they have a list of, and you can get it approved a lot quicker. So Bella is a perfect example to prove all those naysayers out there that keep saying, yeah, everybody's denied the first time. Usually those are lawyers because, if you use a lawyer, there's a higher percentage you get approved. Yes, because they kind of allegedly, lawyers, they pick and choose. You call them up and you say, oh, okay, I'm pregnant. And people come to Social Security. I've taken a few cases of people being pregnant. And I say, you're not going to be approved because your disability, your pregnancy is not going to last 12 months or longer. Even in Florida, it doesn't last 12 months in Florida. But they don't believe me. So I don't care. I want to file. So, okay, you file and you deny it. So that goes into the ratios. And so, yeah. So anyway, I digress. Overpayments. So if you have that overpayment, there's a few ways you can address it. You can pay the amount in full. Nobody pays the amount in full. Some people do, but you can just pay it off. You can appeal the decision, but in your case, you're going to be denied because if it was a bonus from work. If it's unearned income, if it was, an inheritance, or you're cashing out your 401k, or, you win some money in gambling or something like that, unless you're a professional gambler, then that doesn't count. But if it's a bonus from work, then yeah, it will count. So probably the best way is to just go ahead and, if you know it's an overpayment that you're not going to be able to fight, then you just request set up an overpayment a payment plan, and you can do it up to 60 months, and there's zero interest. So that might be the best policy for you. I went to SSA in North Las Vegas, Nevada, and the manager said I can't get my earnings off a different Social Security card that wasn't mine. It doesn't matter the reason. Mr. Oppenheim was not kind and couldn't care less. Opie, yeah, he's kind of blunt. Yes, I've known him for many years. But he knows his stuff. I think he just, I think there's there are sometimes you can get, yeah, Marsh, I really need to know the details on this, because yeah, Opie, Oppenheim, he is, the guy knows his stuff. Really, he knows his stuff. But in your particular case, probably. But people get benefits off of other people's records all the time. If you're a spouse, you can get it off benefits from another person's Social Security record, right? You have to file for benefits on your own record, and then your benefit amount, your full benefit amount, has to be less than that person's. So maybe in your particular case, you're not able to get it. But people get benefits from other people's record all the time. Children get their benefits from their parents that are receiving retirement or disability or that passed away. Disabled widows' benefits get it from their deceased spouses. So yeah, there's millions of people that get benefits from other people's record. But in your particular case, he looked at the record, and it possibly that, yeah, in your particular case, it was a no. So, and he doesn't have the best bedside manner. He's kind of, yeah, I know, but the guy knows his stuff. So there's that. Hey, Don. I have Medicare and my husband's insurance. Do I need Medicare? So yeah, it's, you technically, if you have health insurance from your husband, and that health insurance is from current work, so that means he is currently working, not a retirement plan or anything like that, but he is currently working and receives health insurance from current work, and that employer plan has 20 or more employees, then you don't have to have Part B. You can refuse Part B, save yourself the $185. If you're receiving Social Security benefits, then you keep Part A. That's zero premium anyway. But even then, even if you don't have to, some people do. So maybe in your particular situation, I would check it out. So if your health insurance from your husband is not great, it's costing you a lot of money on a monthly premium. It doesn't cover a lot. There's a lot of co-insurance and deductibles and stuff like that, but you don't have to sign up for Part B, but given what you have there, maybe Part B in a Medicare supplement plan or Medicare Advantage plan might be best. So you can reach out to Chapter, and if you want, and they can, do a comparison. Did anyone else get a book mailed to them about Medicare and You 2026? I just started Medicare in 2025 with the great help from Chapter. All right, perfect. Thank you for letting me know about that. Yes, Medicare and You. Someone complained yesterday that they got that book and, how much it costs to print that book. And I would agree. They kind of automatically send that book out to a lot of people, and it costs a lot of money. I think that's one way to, most people have online access, and you can get the Medicare and You 2026 book online. And if you want it, then you should, order it. But I don't think they should be giving those things out. It costs a lot of money. So, but yeah, it's they have the book. The book has come out, but the numbers haven't come out yet for what's Medicare Part B going to cost next year, and how much are the deductibles and the co-insurance and all that kind of stuff. So, we shall see. When they come out with it, I'm going to do another video and talk about all that. So, Deborah, he previously passed away, and I can keep his insurance, but I have to pay $150 for his insurance, $185 for Medicare. Okay, so he is not currently working. So then you do have to sign up for Part B. Again, You do, but you don't, in the sense of if you are 100% happy with the health insurance you have as a surviving spouse from your husband's health insurance plan, and so you can deny, get out of Part B, but you have to know that in the future, if you change your mind or that health insurance company, the CEO decides to steal all the money and head off to the Bahamas and then left everybody without health insurance, then 5, 10, 20 years down the line, then you need Medicare, you're going to pay a penalty. 10% for every 12 months you did not have Medicare when you were supposed to. And that's also Part D, the prescription drug plan. It's 1% for every month you didn't have it. So there's that. Yeah. Marcia, the lady in North Las Vegas was kind. I got 51,000 added to my earnings record. Will it make any difference with that putting me in the 28 years of earnings? Thanks, Dr. Ware, for helping. Okay. All right. Good deal. I hired most of the people in the Las Vegas area. So anyway, it really depends. Remember, they calculate your benefits based on your high 35 years of earnings. So if that 51,000 was one of your high 35 years, it absolutely will make a difference. So, and that's automatic. They'll do that automatically. So Marcia's a perfect example. Probably Marcia, you looked at your earnings record. So number one, awesome. And then you saw, hey, there's a gap there. I worked 3 or 4 years ago and I made, over $50,000 and it says 0. I need to fix that because that's going to affect my benefit. And you did the right thing. So either you provided your W-2s and everything because those earnings were just not calculated in there at all. So you give them your earnings, or usually what happens is those earnings were there. They were just in a suspense file. So someone along the way typed your social security number in wrong. It's supposed to be 12 and they typed in 21 or something. And those earnings are out there in a suspense file, just kind of, floating around. And then you said, hey, in this year, I'm missing $51,000. And they say, oh, what's your name and where did you work? What's the employer identification number? And you said, oh, it was just the same place I worked the year before and the year after. So Social Security, look at the EIN, the employer identification number, and look in the suspense file. I've done this hundreds of thousands of times. And it says, oh, here it is right here. Oh, yeah, looks like they typed the Social Security number in 1 digit wrong. It's got your name on it, these are earnings. So they just pull it down the suspense file, stick it in yours, and the computer automatically recalculates your PIA, your benefit amount. And if that was 3 years ago that your earnings were corrected and you've been receiving benefits for 3 years, then they will pay you back pay and correct it for 3 years. So, and that's automatic. So you'll probably get a letter in the mail that says, we increased your benefit amount and here's why we increased it and yada, yada, yada. So what happens if you become disabled after your full retirement age? If you become disabled after your full retirement age, then yeah, we all become disabled after our full retirement age, everybody. So there is no disability benefits. If you are at your full retirement age and you're disabled, and your disability began like a year before your full retirement age, then you can go ahead and file and see if they'll approve you for that, back pay and say, yeah, I'm 67 right now. Yes, it's my full retirement age. I know I'm not going to get, disability benefits from now on, but I've been disabled for the last year. And so I can prove that I became disabled, 12 months ago, and then they'll go ahead and do the process and maybe pay you some back months. So, but if your disability began after, then unfortunately no. Let's see here. So somebody else just received their book on Friday. Yeah. So yeah, definitely go through there. And Medicare, all of that stuff. Original Medicare Part A and Part B, a Medicare Advantage plan, Part D, Medicare supplement plans, whatever you got, you paid for all of that, or you're paying for all of that. So use it, use it. if your Medicare Advantage plan gives you some dental, use it. Medicare Advantage plans, those plans expire December 31st. So if you have dental, like $2,000 of dental, then yeah, you have it until December 31st. So you have to use it by December 31st. I was watching a TikTok yesterday, and this gentleman said he just got his ANOC, the annual notice of change. And he was, I have to play that tomorrow if I can find it again. And his grocery card was reduced by about half. His dental was reduced by about half. So he said he's really going to be struggling. And that, I've seen a lot so far, the people that receive their annual notice of changes. And yeah, a lot of people, their plans are being downgraded because next year the health insurance companies are focusing on margins, on profits from each person. So usually they either focus on getting more members to sign up or making more money off of each member. In 2026, it's more money off each member. So they're going to be making a bunch of cuts. Vivian, I'm drawing SSI. My Social Security, my ex-spouse, half of his. Can voluntary delay drawing his until 65. I'm 62 now. Okay, if you're drawing SSI, supplemental security income, no, you have to file for any other benefits you're eligible for because SSI is a welfare-based program. SSI, supplemental security income, does not come from the Social Security Trust Fund, what we paid into it. It comes from taxes. Well, what we paid into taxes, I guess. So anyway, but it comes from general taxation. And Social Security employees are charged with taking care of general taxation. So if you're receiving SSI and you're eligible for benefits on retirement benefits on your own record or spouse benefits or surviving divorce spouse benefits or whatever the case may be, then you have to take those benefits. Yeah. So you probably already received a letter that says you have to file, and you have to file. If you don't, they're going to stop your SSI. So, and I know what you're going to say. If I wait, I'll get more money, and then I won't need SSI in the future. But if I get them now, I'm going to be reduced, and therefore I'll need SSI general taxation for a lot longer. Yes, it is. It's an illogical law. So let's see here. Thumbs up. Yes. I watch twice. So sometimes I watch it twice so I get 2 thumbs up. You guys are awesome like that. Yeah, we have to teach these stupid algorithms to send this out to more people so more people get help. So if I'm already started my early Social Security at 62, I've received a suggestion from Horizon saying, according to my health history, that I'm probably eligible for SSDI. Should I check further? Yes. Good. Janine, thank you very much for asking that question. I was hoping somebody would. So you are receiving Social Security, regular retirement benefits, survivor benefits, spouse benefits, or whatever the case may be. Or excuse me, you're receiving disability benefits and you're eligible for one of those. You can get other types of benefits on top of your Social Security disability insurance. So if you're receiving disability benefits and you're 62 years old and now you're eligible for spouse benefits, then yeah, get those spouse benefits. It's not going to stop your disability benefits. It's just going to offset it. So if you're getting $1,000 from disability and you're eligible for another $500 from a spouse, then you'll get your $1,000 of disability plus $500 from your spouse. But what a lot of people worried about is, well, if I get that spouse benefits, then I'll be on spouse benefits and I'm only 62 years old, so they'll cancel my Medicare. No, 100% incorrect, because you're still going to get your disability benefits. Your Medicare will continue. So, and then you'll just get this spouse benefits or divorce spouse benefits or surviving spouse benefits or whatever on top of that. So let's see, I will be turning 62 in a couple of months and I am bankruptcy and need to continue working. And then the question got cut off there. Bankruptcy, yeah, in terms, yeah, you can. You're probably going to ask, if you receive Social Security benefits, can you work? Yes, absolutely. You can receive Social Security benefits and work. It's just that your work has to be less than $23,500 $400. Anything over that, then they hold back $1 for every $2 you go over. Do I have to pay for Medicare if I only make $1,500 a month in Social Security? Depends what state you're in. If you want Part B, then yeah, you're going to have to pay the $185. But there's a couple of options. If some states, if you're in Texas, then you're probably going to, be out of luck. If you're in Alabama, you're out of luck. But if you're in a state, you apply for Medicaid, and if $1,500 is okay threshold for that particular state, they will approve you for Medicaid, and the state will pay for your Part B premium, that $185. So that's one way to get your Part B premium paid for. And there's going to be a lot of change is with this, beautiful for billionaires bill, that people are going to be losing that $185 either temporarily or permanently, and states are going to be cutting back. It's going to be a nightmare. So we're watching all this. And then there's another option. If you get a Medicare Advantage plan, some of those have what's called the Part B give back, and which they, as the name implies, they give back part of your Part B plan, Part B money. So it could be $50, $100, $185. I think, I haven't seen the numbers yet, but if companies are looking to make more profits this year, if you're receiving one of those Medicare Advantage Part B givebacks, a lot of veterans use those, and the company is paying $185 back to Part B for you, or $100, then thinking the companies are probably going to be cutting those back. So if anybody has received an annual notice of change, and let us know. So anybody on anything, if you received your annual notice of change and you looked at it and you say, oh yeah, they usually don't mess with obviously if you're paying zero premium for your Medicare Advantage plan, it's still going to be zero premium, because if they all of a sudden jump it up to $100, then you're going to go out there and actually look to see if you can find a better plan. They don't want you to look. They just want you to open it up and say, yep, it's still zero next year. So, and then you throw it away and you go on with your life. And then something happens next year, you get sick or injured or something, and you go to the hospital and they charge you $500 a night. And you're like, wait a second, my plan was $100 a night. Yeah, that was a plan last year that you didn't check. Remember? Well, you should have checked it. So it's important that you check it. And Chapter can help you for free, just like everybody else, and also help you after the fact. Do you think it's fair that DAC can't marry and keep their benefits? They can marry if they marry another DAC. So a disabled adult child can marry another disabled adult child. So the Congress, they have determined if you're a disabled adult child and you're dependent, you're getting your Social Security benefits based on a parent that's receiving retirement benefits or disability benefits, or deceased. So you're getting it from a parent because you are a disabled adult child. Even if you're 20, 30, 40, 50 years old, you're still a disabled adult child receiving benefits off a parent. But they think that if you get married, then you've become, I don't know, a kind of a free agent or whatever, that now you've left your parents' household, even though whatever, and you've moved into your own household. So therefore, yeah, you're not a disabled adult child anymore. You've got your own life and separate from your parents. That's the philosophy. Unless you marry another disabled adult child, and then you can keep your benefits. So whether it's fair or not, that's, yeah. Medicare sent me a 49-question survey. I mailed it back telling them I charged $30 copay for it. Yeah, not sure. 49-question survey. Was it from Medicare itself or from a Medicare Advantage plan, or whatever the case may be? Dr. Weir's knowledge never ends. Oh, thank you. I appreciate it. And at least on this subject, a lot of other subjects, physics and anatomy and all that kind of stuff. Yeah, terrible at it. Let's see. My 20-year-old son is autistic. Does he qualify for disability? What do I say? Apply. Some people with autism get it, because autism is a spectrum. So it really depends on where on that spectrum they are. And autism, that spectrum is difficult So, there's from here to there and maybe up to there, they approve it, but maybe your son is right there over the line. And so it's a gray area. So apply. And it's critical that the anybody that's eligible apply before the age of 22 and get a decision that they became disabled before the age of 22, which qualifies them for disabled adult child benefits. So the 22 year is an important year. And so if, they say, okay, we give disability to people with autism up to there, and your son is right there, appeal it. Because there's, that's a fine line to deduce there. So I would definitely appeal it, just like everything else. By the first year of Social Security at age 62, nobody told me, they just said yearly. Okay, yes, Pam, that is a common misunderstanding that unfortunately a lot of people miss, and therefore they make their life very, very difficult. So let me throw it up there. What Pam is talking about is working on and benefits. The first year you collect your Social Security benefits, they can switch to a monthly earnings limit. So normally, if you're filing for benefits early, then you're limited to $23,400. But the first year you apply, if you made over $23,400, Social Security doesn't care if that money was made before you start your benefits. So you can make $1 billion a month. Let's say it's September, and you want to start your benefits in October. So you made $1 billion up until September. But starting in October, you're going to stop working or reduce your money to under the substantial gainful activity, the monthly earnings limit, which is $1,950, $1,950. So Social Security says, oh, you made $1 billion up until September. Okay, who cares? What's great, whatever. But we're going to start your benefits in October. How much are you going to make starting October, November, December? And if you say, oh yeah, I stopped working, or I'll stay under the $1,950, then they can start your benefits. Next year, it goes the entire year. Next year, you have to stay under it the entire year, whatever it's going to be for next year, 23,000, probably 24, 25,000 or something. So, let's see, try to find some new people here. I live overseas and over 70. I have to prove proof of life yearly. We no longer need to mail the form 7162. How do you show proof of life? Yes. So I did a video on this about a week or so ago. They changed the policy effective August 23rd or 24th or something. They added this to the attestation list. And attestation is something the Social Security assigns to particular documents, applications that says you don't actually need what we call a pen and ink, a wet signature. You can get the claimant to attest it over the phone. So what happens is you get in touch with the Social Security employee and you say, I need to do my proof of life. I live overseas and I need to prove I'm still alive and kicking, and I don't want to, I don't have mail. I don't have this, that, or the other. Some countries, they're not mailing to the United States because of all the tariffs and stuff. So a lot of people says, I can't mail anything. They're not mailing stuff to the United States because of the tariffs. So you call and you talk to a Social Security employee, and they will read you the statement. You agree that you're, under proof of penalty, yada, yada, yada. Do you agree with this? Yes, yes, yes. And they ask you a bunch of questions, confirm who you are, and then they can do the proof of life over the phone. So it's called attestation. But when you do that, unfortunately, Social Security employees, they're barely, treading water right now. And so when you call a Social Security employee and tell them that, then they're probably not going to know what you're talking about. And you just tell them, yeah, it came out as an emergency message, or regular message, emergency message. It came out as a message at the end of August that there is an attestation now for this one. And then they do it, and then they send that form to Wilkes-Barre, Pennsylvania. So brand new process. Can chapter help with Part D? Mine has doubled to 95. Absolutely. Yep. Give them a call. Let's see. But remember, they can't change, they won't know what Part D until October 1st. So, and you can't change your plan until October 15th. So the new plans come out October 1st, so you can start looking around and everything, but the actual, you can't change until October 15th. And I've actually got, so if you want to take a picture of this, this is the 6 Ps of the Medicare annual enrollment period, which goes from October 15th to December 7th. So when you call chapter there, we want to make sure everybody gets the plan, the best plan. So it's good to be prepared before you call them. And don't expect, number one, I'll start at the end, patience. Don't expect to call on April 15th, October 15th, because there's, about 1 million people have gotten their plans canceled. And so there's going to be a ton of people trying to change their plans this year. So usually the end of October around Halloween time, November, that's usually the best. So a little bit of patience there, but we'll make sure they help you out. So have your plan ready, what you currently have, so that way they can, they can compare apples and oranges. Your providers, who you want to keep, the doctors that you definitely want to keep. Remember, those networks out there are shrinking, so you have to be kind of reasonable. So the hospitals you definitely want to go to, continue the clinics, your providers, all that. Have your prescriptions. That way, a chapter can find the best plan that saves you the most money for the prescriptions and covers all your prescriptions and everything. Have your pharmacy, what pharmacy you definitely want to use, and then your priorities. Is your most important priority, saving as much money or keeping this particular doctor or getting dental or vision or whatever the case may be. So there's the phone number for chapter. So take a screenshot or on your phone or whatever like that and have that. And then remember, so October 15th to December 7th is when you can change, but your new plan will start effective January 1st, 2026. So the 6 Ps of Medicare AEP. All right, let's see here. If my husband passed at 60, would he be able for full benefits if he made $260,000 a year? If your husband passed at 60, would you be eligible? So, okay, so if someone made the full amount, and remember, for this year, it's $176,100. After that, you don't pay Social Security anymore. That's why, it's completely unfair. But everybody pays, FICA, and every dollar they make up to $176,000. So if you make $50,000, you pay every dollar. If you make $5 million, you don't. Yeah. So anyway, so if he made the max for 35 years, then yeah, he would receive the max benefit. So if he made the max for all 35 years and waited till 70, then he would get the full benefit plus. So people that made the max the entire 35 years and waited till they're 70 are making about, I think it was what, $5,100 or so, over $5,000. This year is the first time Social Security benefits had gone over $5,000. So, thanks. Even with a PPO, no dentist in the network is the issue in Kentucky with, unfortunately, Kimberly, you might not have that issue anymore because that particular company that you mentioned, I try to avoid, talking about these companies because they're so sensitive. They announced that they're going to be canceling 600,000 people's PPO plans. And so you might not have that plan. So if you received your ANOC, your annual notice of change from that company that says, hey, bye, we're going to cancel your plan, then you have an opportunity to get into a Medicare supplement plan, at least check it out, see if that's best for you. If not, then you just find another Medicare Advantage plan. But unfortunately, I think in January here, we're going to be doing this live Q&A, and someone's going to come into the live Q&A and it said, I just went to the doctor and I've had this plan for 5 years. And I went to the doctor and they said my plan was canceled. Yeah, we're going to see that a lot, unfortunately, because people get their plans canceled and they don't switch. They don't open the letter, or they didn't get the letter, or they didn't check. So I got my ANOC premium is still zero. Yep. They almost 99.9%. They always do that because, if they ramped it up, then that would be a, super red flag. So, but and you kept checking. Good. There you go. But the deductible went up from 590 to 615, tier 3 and up, and copays went up. No change for me for my tier 1 blood pressure medication. Yeah, so copays went up, probably deductibles for, hospitals, specialists. Yeah, I think a lot of the stuff is going to go up. So yeah, if you're happy with that, then you don't have to do anything. It just automatically renews. Your plan this year automatically expires December 31st, and this new plan will start January 1st. But if you want to check to see if there's something better out there now, then, reach out to whoever you have help you, reach out to chapter, whoever the case, and check out all your options. All right, I've only got one video question today. Let's see what this young lady has to say.
Yes, I heard you say on your podcast earlier today that I could draw from my husband that I'm married to now. Something about if my Social Security was less than half of his, that I could draw from him. Is that true?
That is a fact. But remember, we have to look at the correct numbers. Social Security determines spouse benefits based on what's called the PIA. So your benefit, if you would have waited till your full retirement age, that amount. And then your spouse, if he would have waited till his full retirement age, that's the amount they compare, not what your checks are. That's called the MBA, your monthly benefit amount. They look at those two PIA numbers, the primary insurance amount. And you're like, I don't know what those are. Yeah, no problem. Just call Social Security with him on the phone there and say, hey, can I get anything from this guy? And they'll check both of your PIA. And if you're eligible, then they say, yep, you've got some money there. And they'll schedule an appointment and you will get their money. So it's a beautiful thing. Dr. Oz rubs me wrong. He doesn't really care about people, only the position he was given. Yeah. My brother applied for disability. They sent forms asking about his eyes. Had 6 strokes, his eyes affected for life. He is my caregiver and they know. Will that reject him or not? No, not necessarily. No. So the case is up at DDS. It sounds like they're making the medical decision. DDS is the Disability Determination Service. It's a state agency that makes the medical determination. And they just have a little bit more information. They're usually on that, they're determining whether they should go to blind, seeing impaired. So that is a different category and different criteria. So, he has these disabilities, but if he's also blind, there's other substantial gainful activity thresholds, and it changes a lot of stuff. So that's why they're asking to see if that should be addressed. So it sounds like they're doing their job. So that's a beautiful thing. Yep, fill it out, be honest, make copies, and return it to them. Usually, if they send it, and they'll send you a cover page with a big barcode on it, and then you just fill it out and then take it to some place that has a fax, those old fax things, and you fax it in, and make sure you get a confirmation receipt. So go to some place and say, hey, do I get a confirmation receipt that the fax went through? And what happens is the fax will go through, and then the fax machine will print out a little sheet that says, yes, the fax was sent, 5 pages was sent. And that way you keep that with your little package. And that way you can confirm that it actually got to Social Security. And FYI, I was the guy that helped design that paperless system. So it works. All right, we are way over an hour, and I apologize. I got a lot of questions there. I'm going to do the 4th and final installment of our top 20 questions tomorrow. And it's going to be Medicare, Medicaid premiums, Medicaid premiums, and then throwing in a little bit of stuff working overseas and how COLA works. So that'll be tomorrow. So I apologize if I didn't get your questions today. I will answer a bunch of questions tomorrow as well. And remember, you can always make one of those videos. So go onto my website, mygovexpert.com, click on the little camera icon on the bottom level, the bottom left, and record a video, and I will answer it tomorrow. Y'all have a beautiful day, and please, 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 please take care of each other. Bye-bye.